The kidney's metamer is related to the feeling of fear. Now, to identify this metamer, we have the dotted line from the elbow to elbow. Then we have the dotted line at the natal cleft. We divide that first into two and then again into two. Also the other space, we divide that into two. So we come up with 4 metameric segments. Now I'm going to draw immediately underneath the stomach metamer the kidney's metamer. So we have the right and the left kidneys. Now, finding tension in the kidney's metamer is very common. Normally, people don't go around displaying their fears, so usually these fears are concealed. They can be the fear of letting oneself go, the fear that something will happen to our children or to someone dear to us. So everyone has their fears, and it's not up to us to really understand what these fears may be. Our task, on the other hand, should be to loosen up this metamer so that once it has relaxed, the communication with the nervous system will improve. So where before the person had an exaggerated fear and this was amplified through this tense metamer, if we loosen up this metamer, and so that person will feel that fear. If this happens when the metamer is tense, this fear will be magnified, whereas if the metamer is relaxed, that fear will not be perceived as strong. And the patient will be much more serene and will live their day in a much more relaxed manner. So we work on this metamer, we loosen it up really well. Consider that this, as the other metamers, if it remains tense, it will tend to alter the functionality of the kidneys. One of the undesired effects is liquid retention. If we alleviate this metamer, you will notice that the person, over the course of the following massages, will tend to go to the toilet more often and will also give off excess liquids. Why? Because we have improved the functionality of the kidneys, and these in turn will get rid of excess liquid. Okay, now we're going to draw the large intestine metamer, which lies immediately underneath the kidneys metamer. The intestine is 1, so it is centrally positioned, and it is related to the emotion of sadness. Because it is centrally positioned, we're going to find half of the nerve supply developed on the right side and the other half on the left. This is a slow motion picture. Now, in the lumbar region, as we've seen for the kidneys zone, the tissue or the skin is always thicker. This is the case for most people. So doing the palpé relay technique here is quite difficult. Now, consider that this model is very young, and yet you can see that the thin is thicker than it was in the liver segment. So this area is richer in fat. This is common to all people. So don't worry if you won't be able to work out this technique well enough. Just do what you can. The important thing is that you grab the skin and then you roll it as much as possible all the way down. Now, this metameric segment is related to fear. Now, if we unblock this metamere on people who suffer from constipation, you will always obtain excellent results. In fact, 95% of the times, which is a very high percentage, it's not 100%, but I've had cases of constipation that were so serious that even by using other more advanced techniques, I was not able to solve it. But I think that 95% is, in fact, a very high percentage, and then believe me, it's sufficient. Okay, so we do the palpé relais technique throughout the entire metamere. That was the real speed. Now I'm showing you in slow motion. And when you work on the right side of the metamere, you will be acting on the first part of the stomach, which is the ascending tract. When we work on the left side of the metamere, we will be acting on the final part of the intestine, where we have the descending colon, we have the sigma tract, and the rectum, where hemorrhoids form. So we're going to do the palpé relais throughout this segment. The emotion will be perceived differently. So where we have like a deep feeling of sadness or of abandonment, these will improve. And for those people who used to repress their cry, it will be more difficult for them to repress. So we work the whole metamere, and then when we will look at dermalgias, I will show you how this technique actually works. As for the small intestine metamere, okay, this metamere, first of all, is related to it's connected to the heart. Now, I'm sure you have remember the last time you had a wholehearted laugh when you went to the movies, for example, or in other situations. Now, the intestines, probably remember, it started to jump. Well, if this intestine remains tense, it will tend to alter the functionality of the same intestine. So it is your task to do the palpé relais on this area. And as I was saying before, it's much more difficult to do. It's not impossible, but it is more difficult. The relation with joy, you will notice that when you work on the heart segment, the patient will have a stronger perception of this feeling. It happened to me, for example, with one patient that he confided in me, and he said, you know, I went out with a bunch of friends of mine, and they told me a really silly joke, but I started laughing so wholeheartedly, something which I don't remember ever doing, and I felt my stomach jumping. Well, this is because we reactivated the connection to the nervous system, so between the intestine and the perception of the feeling of joy. In addition to the connection to the emotion, we're also looking at the function of the small intestine. Now, the small intestine has the function of assimilating what we eat. So if the small intestine is contracted, this absorption is going to be altered. So as I was saying before, your task is to loosen it up. Consider that any intolerances and allergies, by loosening this metameric segment, they're not certainly going to go away, but they will certainly improve. So by working on the nerve supply related to the small intestine, this is going to work more. The patient will suffer less from swelling in the stomach, and they will certainly be grateful to you. The last of the 10 metameres is the urinary bladder metamere. This is related to the motion of fear, just like the kidneys. Now, just consider that it would be a severe shock due to fear could cause someone to pee in their pants. This can happen by affecting the bladder. So at this point, you'll have to loosen up this metamere. Again, it's a little bit more difficult, but it's not impossible. You loosen it up. This also happens with the regulation of liquids, so the person will tend to go to the toilet more frequently, but they will also be less anxious. You have to know that the bladder also regulates muscle tone. So now I'm going to explain to you the difference between muscle tone and lack of muscle tone. Well, here we have a good example of muscle tone. She's 20, so but if a person had suffered a shock, or for example, when you find burglars in the house, and now, for example, in the case of my former girlfriend, she suffered a trauma because she found burglars in her house. Well, this was so strong that she suffered from bladder trauma. And this former girlfriend of mine, even though she was young at the time, lost all the strength in her muscles, and her muscles were completely flaccid. She was thin, but just to make you understand how the nervous system affects the bladder, and this regulates the tissue, so lack of muscle tone. Now I just want to go back to the other video connected to the gluteus. Now, the gluteus are not metameres. To identify the genital zone, we need to draw a cross at the center of the gluteus and then draw a circle around the center of this cross. Here we find the genital system reflex zone. If it's difficult to work on this with the palpé relais technique, then we can use another technique, which is the acupressure technique. This simply by putting pressure with your finger. Here I'm showing you how it is stimulated. Now, bear in mind that to stimulate the gluteus, you have to put pressure, and then you pinch the skin from the outside inwards. Now, by rolling the skin between your fingers, you will find the exact spot where it hurts, and the person will feel it like a pinching needle. Once you have identified this spot, you will massage it until the pain is completely gone. It'll take about 4 to 5 minutes per gluteus. It's long work, but given that often they are very painful, try to measure out the pain. The results are quasi-miraculous. In case of women, the physical effects are a regulation of the menstrual cycle. You will improve menstrual pain. You can help the woman. If the woman did not have a menstrual cycle, these cycles will come on again. I'm famous for this here, and in fact, everyone tends to send people to me when they have problems with their menstrual cycle, and I assure you that after a couple of days, only after a few sessions, I can improve that. So always do this massage in a closing direction, just so as not to embarrass the patient. Don't use your whole hand. In other words, don't palpate. Try to be very professional, because it is an intimate area and the person will understand whether you have other intentions. I trust that you're very professional. I have no doubt about it. In this video you can see this stimulation. Now, something that you should note is whether the gluteus are cold. If there's tension in the gluteus, there will also be less blood in circulation, so the gluteus will be very cold. This is another reason why you should massage this area. So work on them until they finally warm up a little bit. Well, I'm glad that I remembered to explain this to you, because this could also happen with the other metameres. When you feel that a metamere is particularly cold, that is an indication that not enough blood is circulating in that area. Okay, so we massage it, and then you will notice that this part will warm up. I always work on the gluteus with my patients, also because they have a hormonal reaction in that they produce what I call a natural antidepressant. The patient will feel much more energetic afterwards. This is probably because a substance of testosterone is secreted, both in men and women, which makes them feel more energetic. Now, as I was saying in the other video, stimulating this area will improve the functionality of the prostate and of the testicles. What's more, you will also increase sexual desire. It's inevitable. There will also be greater control in intercourse, and the increased blood pressure in the genital area will also increase the size of the male sex. It's true. Now, not that this person is going to turn into some famous actor we know, but in fact, if I'm a little familiar with the person, I will tell them, you know, after this increase in blood pressure, you're going to have an increase in size. Patients actually think I'm kidding, but then soon after they confirm that this is actually true. Now, of course, don't do this if you're not familiar with the patient. You might pass for an unprofessional. So, while in men there's greater control during the sexual intercourse, in women we find that this causes greater sensitivity, vaginal sensitivity. So obviously there's much more sexual pleasure, and many problems related to the sexual sphere will be solved thanks to this technique. But again, I repeat it. Try to be as professional as you can and be very delicate when you approach these topics.